Today we are going to learn the Renin Angiotensin system. To understand it better, first of all we will learn the microanatomy of the nephron of the kidney. So this is the kidney anatomy and glomerular structure. As we can see, this is the Bowman capsule, and here is the afferent arteriole, and it enters the Bowman's capsule and leave as the efferent arteriole. So afferent arteriole comes and efferent arteriole leaves from the Bowman's capsule, and it is lined by the endothelial cells, and here are the juxtaglomerular cells. These are the very important cells which play important role in the regulation of the blood pressure. And here is the section of the distal convoluted tubule, and these cells present in the distal convoluted tubules are known as the macula densa cells. Macula densa cells, juxtaglomerular cells, and here are the present in the afferent arteriole. There are the present the baroreceptors of the kidneys. So all of these cells and makes a system which regulates the blood pressure. So and these are the podocytes which are present in the visceral layer of the Bowman's capsule. This is the parietal layer and this is the visceral layer, and these are the podocytes which plays role in the selective filtration of the substances. And these are the mesangial cells, and this is the basement membrane of the glomerulus. Coming towards the Renin Angiotensin Aldosterone system, here we can see the same structure, distal convoluted tubules having macula densa cells, and glomerulus having afferent arterioles, network of the capillaries leaving as the efferent arterioles, and these are the juxtaglomerular cells. Now, which factors activate the renin angiotensin aldosterone systems are decrease in the BP, which is detected by the renal baroreceptors, decrease sodium chloride delivery, which is detected by the macula densa cells, and increased sympathetic tone, which is detected by the beta 1 receptors. Juxtaglomerular cells releases the renin, and it goes into the plasma where it acts on the angiotensinogen, which is already present in the plasma, and it is synthesized by the liver. So liver synthesizes the angiotensinogen, which secretes it, which is secreted in the plasma, and the renin produced from the juxtaglomerular cells due to the decrease in the BP and sodium chloride in the circulation. Renin is produced and it acts on the angiotensinogen, and it converts it into the angiotensin 1. Now angiotensin 1 has to be converted into the angiotensin 2 because it is the active form which will act on multiple systems to regulate the BP. But for this conversion we need an enzyme which is known as angiotensin converting enzyme, which is secreted mainly by the lungs. So lungs secrete angiotensin flowing in the plasma reaches the lungs area, then lungs releases angiotensin converting enzyme, and angiotensin converting enzyme converts angiotensin 1 into the angiotensin 2. Now angiotensin 2 acts on multiple systems like blood vessels, on the kidneys themselves, and on adrenal gland and the pituitary gland. Pituitary to activate the multiple mechanisms for the regulation of the BP. First of all, it acts on the vessels, and there are present angiotensin 2 receptors on the vessels, and which are activated by the angiotensin 2 and causes vasoconstriction. So it acts on the blood vessels and causes vasoconstriction, which in turn causes increase in the BP. It acts on the glomerular cells. It constricts the afferent arterioles, due to which fluid filtration increases, and it reserves the glomerular filtration when renal blood flow decreases, and prevents the kidney from the ischemic changes, as the glomerular basement membrane is very prone to the ischemic changes. So by constricting the efferent arterioles, this is the afferent arteriole and this is the efferent arteriole. So it constricted the efferent arteriole so that the filtration increases, fluid flow increases, and there is the preservation of the renal blood flow. But it also regulates the sodium chloride reabsorption through the distal convoluted tubule. So blood volume also and sodium chloride also preserved in this method. It acts on the proximal convoluted tubule, which will present here, proximal convoluted tubule cells of the kidney, and increase sodium and hydrogen activity. So by this method it increases the sodium bicarbonate and water reabsorption, which permits contraction alkalosis. It acts on the adrenal gland and causes aldosterone secretion, which acts on alpha intercalated cells and principal cells of the kidney. By acting on the alpha intercalated cells, hydrogen secretion via hydrogen ATPase activity increases, and then it acts on the principal cells, then sodium reabsorption and potassium secretion increases. By this method it also preserve the sodium concentration in the blood volume to increase the BP, and when it acts on the principal cells, it also causes the water reabsorption through the aquaporins. So when it acts on the hypothalamus, it causes two methods to activate. First of all, it increases the thirst, by which the person takes more water in his diet and blood volume increases, and it also releases ADH, which is antidiuretic hormone from the posterior pituitary. And ADH also acts on the principal cells, which are the renal cells, and causes the same function which is discussed previously, that is, it increases sodium reabsorption and potassium secretion for the preservation of the plasma osmolality, and it causes water reabsorption via aquaporins. So in summary, renin is secreted by the juxtaglomerular cells in response to decreased renal perfusion pressure, which is detected by the renal baroreceptors in the afferent arterioles. Afferent arterioles contain the renal baroreceptors, and increase renal sympathetic discharge, which is the beta 1 effect, and decrease sodium chloride delivery to the macula densa cells. So by all these mechanisms, the renin is released from the juxtaglomerular cells. Then renin acts on the angiotensinogen, converts it into the angiotensin 1, and angiotensin converting enzymes catalyzes the conversion of angiotensin 1 to angiotensin 2. It is located in many tissues, but conversion occurs mostly extensively in the lungs, and it is produced by the vascular endothelial cells in the lungs. So it converts angiotensin 1 to angiotensin 2, and angiotensin 2 then acts on the vessels causes vasoconstriction and increased BP. It acts on the glomerular efferent arterioles of the kidneys to increase the fluid flow, and it preserves the glomerular filtration rate. Then it acts on the alpha intercalated cells and principals of the renal cells, where it increases hydrogen secretion and potassium secretion and increase sodium and water reabsorption. It acts on the adrenal gland and causes aldosterone secretion, which also acts on the alpha intercalated or principal cells, and it causes increased sodium and hydrogen activity in the proximal convoluted tubule cells, which reabsorbs the sodium bicarbonate and water. It acts on the ADH, which increases the thirst, and it also acts on the principal cells for water reabsorption and sodium reabsorption. So this was the brief overview of the angiotensin aldosterone system, which detects the decrease in the blood pressure, and it causes increase in the BP by activating following mechanisms, and it causes the long term regulation of the blood pressure. Short term regulation of the blood pressure is done by the baroreceptors in the carotid bodies and carotid bodies and aortic bodies. Mainly carotid bodies play a major role, and if the long term regulation of the BP is asked, then it is done by the renin angiotensin aldosterone system.